Hello everyone. Today we, the clinical instructors, along with the nursing students of Holy Family Institute of Nursing Education, would be demonstrating how to perform physical examination. A medical examination to determine a person's bodily fitness is called as physical examination. Articles required: a clean tray containing dry swab, wet swab, soapy swab, onion for smell, sugar for taste, hammer, tuning fork, thermometer, a wristwatch, measuring tape, stethoscope, ruler, torch, kidney tray, paper bag, and a sphygmomanometer. Assessing the general appearance. Assess the general hygiene and grooming by assessing if the patient is clean and neat and if the hair is combed. Assess the level of alertness. Check if the patient is oriented to time, place, and person. Assess for signs of distress. Check the patient's facial expressions. Assess the position and posture of the patient. Assess the patient's body size. Check whether the patient is malnourished, well-nourished, or overnourished. Assess the patient's speech for any abnormalities. Assessment of anthropometric measurements. Check patient's height in centimeters. Check weight in kilograms. Assessment of vital signs. Temperature can be checked at axillary, oral, rectal or tympanic sites in degree Fahrenheit or degree centigrade. Pulse can be measured at various sites in beats per minute. Respiratory rate should be measured in breaths per minute. Measure BP in mm of Hg. Assessment of skin. Assess the color, whether pink, tan, brown, bluish or pallor. Assess the vascularity for bleeding, bruising, ecchymiosis or petechia. Assess skin integrity for macules, tumor, nodules, warts, moles, birthmarks, wound, scars, rashes, papules, acne and vesicles. Assess the skin texture if it is fine, thick, smooth or rough. Assess for edema and its location and type. Assess the nails for any abnormalities. Assessment of head. Assess the head shape, whether it is round, oval or normocephalic. Assess the face if it's oval, long, round or symmetrical. Assess the hair if it is coarse, fine, thick or thin, and if the patient has alopecia. Assess the scalp whether it is clean or whether there is any lump or dandruff. Assessment of eyes. Assess the eyelids for inflammation, infection, ptosis or stye. Assess the shape and appearance of the eyes. Assess eyelashes if they are long, short or artificial. Assess the eyebrows for color, shape and alignment. Assess conjunctiva for redness, inflammation and swelling. Assess the cornea if it is clear, milky, opaque or cloudy. Assess the lacrimal glands for inflammation, swelling or tearing. Assess the iris for color and shape, and check whether the patient is using any visual aids. Assessment of ears. Assess the pinna for its size and shape. Assess the level and proportion of the ears to the face. Check for the use of any hearing aids. Assess the ear canal for inflammation, discharge, redness or foreign objects. Assess the hearing capacity. Assessment of nose and sinuses. Assess the size and shape of the nose. Check whether the nasal septum is in midline or is deviated. Assess the nasal mucosa and turbinates for redness, dryness, discharge and epistaxis. Assess the sense of smell. Assessment of mouth and pharynx. Lips. Assess the lips for color, shape, or any abnormal conditions. Teeth. Assess the color of the teeth and conditions such as dental caries, malocclusion and protrusion. Assess the patient's dental hygiene. Assess the breath odor for alcohol, drugs or halitosis. Assess the gums for swelling, bleeding, gingivitis and ulcerations. Assessment of tongue. Explain the patient to protrude the tongue out and assess with the help of a torch. Assess the tongue for fissures, glossitis, micro and macroglossia. Assess the palate for moistness, dryness and color, and assess the uvula for color, midline and gag reflex. Assess the pharynx for color, dysphagia and petechiae. Assess the tonsils for redness, exudation and tonsillitis. Assessment of neck. Assess the neck appearance. Assess the thyroid by palpation. Assess the jugular veins for distension and prominent pulsation. Assess the lymph nodes. Assessment of thorax and lungs. Inspect the shape and symmetry along with the anterior-posterior diameter. Assess for barrel, pigeon and funnel chest. Inspect the breathing pattern and assess for signs of respiratory distress. With the help of palpation, check for the symmetry of chest movements. Inspect the expansion of chest. Perform percussion to determine whether the underlying tissue is filled with air, fluid or solid material. Auscultate from the lung apices to the base. Assessment of the heart. Inspect and palpate the heart for precordial bulge, abnormal pulsation and point of maximum impulse. Auscultate the heart for abnormal heart sounds and murmurs. Assessment of breast and axillae. Assess the breast whether it is large, small or well developed. Check for abnormalities such as lumps or masses, skin changes and redness. Assess for gynecomastia in males. Assess for deviation, discharge, rashes and dimpling in the nipples. Assess the axilla whether it is shaved or unshaved and check for rashes, lesions, masses or lumps. Perform proper assessment of lymph nodes. Assessment of abdomen. Inspection. Assess the patient's skin for color, lesions, etc. Check the umbilicus for position, shape, color, inflammation, discharge or protrusion. Check the contour and symmetry of the abdomen for any irregularity, protrusion, enlargement, distension or scaphoid. Auscultation of the abdomen. Auscultate the abdomen for bowel sounds and check for the presence of hyperactive, high-pitched tinkling sounds and sounds of gurglers, etc. Also auscultate the abdomen for vascular sounds to check the presence of bruits. Percussion of the abdomen. Assessing the percussion of the abdomen is essential in determining the size, shape, and density of the abdominal contents. Palpation of the abdomen. Palpate the abdomen to check for the presence of tenderness, muscular resistance, swelling, hepatomegaly, or hernia. Assessment of extremities. Assess the joints for redness, swelling, pain, or deformity. Assessment of peripheral reflexes. Assessment of muscle strength. Hold the patient's hand and apply pressure on the hand towards the patient and instruct the patient to resist this pressure. Compare the extremities for abrasion, edema, or varicose veins. Assess the peripheral pulses. Assessment of back. Assess the shoulder level. Check the spinal alignment for any deformities. Inspect for lesions, dimple, or tuft of hair along the vertebral column. Assessment of genitalia and rectum. Assess the rectum for inflammation, hemorrhoids, rashes, fistula, anal fissures, or lesions. Assess the female genitalia for hair distribution, inflammation, lesions, cysts, or varicosities, and also assess for uterine prolapse. Assessment of the colors of vaginal discharge are essential. Assess the male genitalia for hair distribution, scrotal edema, cryptorchidism, phimosis, hydrocele, hypospadiasis, and epispadiasis.